Hello, everyone. Thank you so much for joining me on this program today, focused on African women's health. This is a program that is dedicated to promotion of African women's health at home and abroad. We share the global message of health for all and emphasize that African women must not be left behind in optimal health. Just in case you are joining us for the very first time, my name is Dr. Olayide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, we concluded our discussion on female genital mutilation, and we promised to start a conversation on fibroid today. Uterine fibroid, also known as fibroid, is experienced by women due to biological reasons, and it is as a result of abnormal growth in the uterus. The growth is benign, and that is to say that it is not cancerous. A number of suggestions have been made in terms of the causes of fibroid. Generally speaking, the causes are unknown. However, it has been linked to abnormal reproduction of female hormone, progesterone and estrogen, and situations whereby you have abnormal production of these two female hormones, they have been linked to fibroid. There are a number of risk factors that have been suggested for fibroid. Number one on the list is that of race or ethnicity, and this is due to genetic variations between the whites and the blacks. Available studies suggest that it is more prevalent among the blacks than the whites. Few studies that have been done in United States of America suggest that fibroid is recorded for about 2 or 3 more times among the blacks when you compare that with the whites. It usually presents earlier among the blacks, and by the time it is diagnosed, it usually presents as larger tumors. So there is more risk factor and greater severity recorded in studies that are available with fibroid among the blacks than when you compare that with the whites. There are a number of signs and symptoms for fibroid. Some of them include abnormal bleeding. The bleeding can be heavy, it can be irregular. And there's also the issue of frequent discharge of clots. If you are experiencing any of these signs and symptoms, we encourage that you see your doctor. Other suggested signs and symptoms are severe pelvic pain or constipation or bloating. To rule out the possibility of fibroid, or even to initiate immediate management of this experience, we suggest that you see your doctor. There are a few suggestions of different types of fibroid, depending on where the growth is. The growth can be within the uterus, it can be outside, or even under the uterus. In terms of intervention, generally speaking, surgery has been indicated, and for women that have passed their reproductive years, hysterectomy has been used in terms of addressing the issue of fibroid among many women. Before we round up the program, I believe it's very important for us to rule out some myths, or even to bring about some clarification. Number one on the top of the list, majorly speaking, is that of fibroid causing infertility. Studies that have been conducted in this area have emphasized that it does not cause infertility. Neither does it stop a woman from becoming pregnant. However, women that have fibroid experience more complications with pregnancy. Like we mentioned earlier on, depending on where the growth is, can present more risk to normal growth and development of the fetus. And I believe that is where the risk is, that is where the complications may be, and that is where some people that might have associated it with infertility may be drawing their argument from. But like we have just said, it doesn't cause infertility, but it may present a number of complications and risk the normal growth and development of the fetus. And that is it for me for today. Next week, we'll be looking at cervical cancer issues. So please stay tuned. Join me on this program, and I look forward to meeting you again next week, Monday, when we meet on the program focused on African women's health. But meanwhile, in case you are wondering who is presenting this program, my name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Please like this video, share it, and together, let's promote African women's health. Until next Monday, thank you so much. It's bye for now.